Hi, I'm Dr. Tieche from Recharge Clinic, and today I wanted to talk about another service that we offer here at Recharge Clinic, and that's iron infusion therapy. So people may wonder what that involves and what is the purpose of it. So the only purpose of it is to treat iron deficiency, and really truly symptomatic iron deficiency. And so people can have just low iron, and people can have iron deficiency and anemia. So the two are not together. So someone can say, my blood count is normal, I don't think my iron could be low, but that's incorrect. One of the things that happens right before your blood count drops is your iron goes down, and then you don't have the ability to make red blood cells, because that's what's important in that, and that's what carries the oxygen. So prior to that, if your iron goes down, which this, let me say, is a worldwide problem. Iron deficiency is the #1 nutritional deficiency in the world. It's pretty shocking when you hear about that, because you don't even hear anything about it. But 30% of the population has iron deficiency. So it's very, very common. And so what are some of the symptoms? How would you even know you have iron deficiency? Well, the most common symptom is fatigue, just being tired all the time, despite having blood work that looks normal and getting plenty of rest, and eating well. People are just tired all the time. They also have other symptoms. They may get restless legs, fidgety legs. They may have all of the kinds of somatic symptoms. Their arms hurt, headaches, things like that. And so there's a lot of things that can happen, that may happen to you that cause these symptoms, and unless you actually look for it, you're not going to find it. So I think it's worth an investigation for people if they have some of those symptoms, particularly fatigue. That's the most common one. And they've had labs done, and it seems to be everything is normal and you can't figure it out. It's worth looking at iron. Now, how do we replace iron if we don't want to do an infusion? Well, there's oral iron therapy. There's iron tablets that people can take, and there's a whole variety of those. The main problem with iron tablets is it takes a long time to bring your iron up. So people have to be on it for years to really bring it up into an acceptable level. So that's why people get frustrated. Sometimes the iron tablets can bother your stomach, make it irritated, they can make you constipated. So what happens is people take them for a while and then just give up and just figure they'll just suffer with it. So I wanted to let everyone know that iron deficiency is a very big problem. Like I said, the #1 nutritional problem. And if you've tried oral iron therapy and have not been successful, or unable to tolerate it, or are even concerned that you have it, really check your levels. But we also offer iron infusion therapy here.